let's do all that stuff. And then we'll take a break around 9:30. And Ms. Everson, call me then. All right, let's see. All right. Mr. Craven, what is this red muscle right here underneath this other muscle here? What's this red muscle right here, sir?
Brachialis.
Yeah, he's right. Really good. Why that's impressive is he had to know that the brachialis lies underneath the biceps brachii, right? And he identified that. And you really can squeeze the brachialis by going around the biceps brachii if you want to. So really, really kind of helpful. I'm hoping these pictures, by the way, actually help kind of place the muscles in your mind on the human body. Thank you, Mr. Craven. Mr. Bose. Oh, Mr. Bose, what is this muscle?
Okay, it's on the...
I could talk to you about it a little bit.
Could you see my brain's a little scrambled.
Mr. Bose, what's interesting about this muscle is it comes from the brachial region and runs down the radius.
The brachial radialis.
Oh, yeah. It is the brachial radialis, everybody. Here's what else is interesting about this muscle is what muscles lie on this side of the brachial radialis. This is the posterior side of the forearm.
The extensor muscles.
Yes! Of the extensor muscles of the wrist and fingers, yes. And what muscles lie on this side, the anterior side?
The flexor muscles.
Yeah. So that's kind of cool. That's what the brachial radialis divides those two, everybody. Very good. Thank you, ma'am.
Thank you.
Mr. Richards, yes, sir.
But does that get confusing? Because it looks like it goes to the thumb, right?
Yeah.
So does people think that's the extensor hallucis longus sometimes? No?
Oh.
Or is it just because it crosses the elbow that it isn't?
Yes, thank you. I actually never thought about that, but you make a really good point. Yes, it's because it crosses the elbow that I know it's not the extensor hallucis longus. But I've never thought about it that way, sir, and that's actually quite brilliant. Because you're right, it's kind of on the back side of the arm, and it kind of would be. But remember, all your hallucis muscles only go about halfway up the arm, right? But still, this thing crosses the elbow. But yes, that exact logic is how you would take this test. Yes, Ms. Carrillo.
Mr. Singletary raised first.
Oh, Mr. Singletary, yes, sir.
That's okay, thanks. I guess I was wrong. I thought that was the Flexor Carpi Ulnaris.
Yeah, so it's really important this person's arm is in a neutral position. Okay. If it was a flexor, you'd want to be really on the anterior side of the forearm. This is not on the posterior or anterior side of the forearm. It's on the radial side. And the radial side is technically the lateral side of the forearm. So it's not front or back, right? It's on the side.
On the side, then?
Yeah.
So it would act like the peroneals in a way?
Well,
it's on the side.
It doesn't act like the peroneals, but you're right. It is like the peroneals. Yes, I love that comparison. It runs down the radius like the peroneals run down the fibula.
Okay, all right.
But it basically, by the way, acts like a little bicep, guys. It helps you do a bicep. It helps you do a flexion of the elbow. It also, remember, this is the one that helps you partially pronate and partially supinate.
All right, thank you.
Thank you, sir. Mr. Richards, you're actually up next. All right.
I still had a question.
Oh, sorry. Hold on 1 second. 1 second. I forgot about Miss Carrillo, who told me not to forget about Mr. Singletary. Miss Carrillo, yes. Sorry, you were behind my camera there too.
I don't remember if I said anything about it, but it just occurred to me. Any of the muscles on the humerus, they're just referred to as brachii. It doesn't extend. The name brachii doesn't really extend into here unless it's attached up to the humerus. Like coracobrachialis, triceps brachii, biceps brachii,
brachioradialis.
And brachioradialis. Because it's all in the humerus.
Yes. And by the way, triceps brachii. Your triceps are called triceps brachii.
Yeah.
So yeah, if it's up in the humerus, except for the deltoid and stuff way up high up there.
Oh, that's just a hack for all of them.
Yeah, it's a good hack. She's right.
Okay.
All this stuff that kind of seems to kind of start or live on the humerus seems to, not all of it, but basically, yeah, it has brachii in it. Biceps brachii, brachialis, brachioradialis, triceps brachii. Yeah, thank you, ma'am. Very helpful. Sorry, Mr. Richards. Now, sir, what do you think this is?
Mr. Bose has got her hand up as well.
Oh my goodness, Miss. I'm sorry, Mr. Bose. Yes, ma'am.
Thank you, Mr. Richards. Just a real quick question.
Yeah.
So yesterday, when I was asking people the muscles, there was a muscle that came up that was like the piriformis or something, and I wanted to figure out what muscle group it was, how in depth you went over it, and like.
This is not the.
I know all muscles are
I
important,
think it's got bones.
but how important
Is this the piriformis?
No.
The pyramid
It's the
one.
piriformis.
Oh, the pyramid. No, it's not important.
Okay.
Not everybody has it. It's extremely tiny. Doesn't have much of a function. No, let it go.
Okay.
You'll never hear about it again. I don't. Yeah. Thank you for asking, but no. Cancel clear. Okay. Everybody's hands. Okay, Mr. Richards, sir.
So this is on the posterior side, so it's obviously an extensor, but
Yeah.
it's on the edge, so it still could be an adductor.
No. Stick with extensor. I love your logic. Stick with extensor.
And I can't really see if it goes to the thumb or does it go to the other fingers? 'Cause
No,
yeah.
it looks to me like it just kind of goes barely across the wrist.
Okay, so then it's the extensor. Summa Ulnaris, Carpi.
Yes, Carpi. What?
Extensor Carpi longus. It's not even a muscle, is it?
So extensor, Carpi, and what's it running by?
Radius.
Yeah. So what might we call it?
So extensor Carpi radialis.
Yeah. Yeah. Very good.
Longus.
Don't worry, by the way, the final has nothing about longus or brevis. We don't try to trip you up. We wanted you to do exactly what Mr. Richards did there. And very likely, just to reassure you guys, the stuff I would put in there to throw you off is I'd have Flexor Carpi radialis on the test, right? Because I want to make sure you know that the extensors are on the back and not on the front, things like that. And I probably would have extensor Carpi ulnaris too, because I want to know, do you know where the radius is as opposed to the ulna? But I wouldn't have, like, you deciding between longus and brevis and all that kind of stuff. So anyway, he did the exact right thing. It's on the back side. It's an extensor. It goes across the wrist, and it looks like it just goes across the wrist, so it flexes the wrist. Carpi. And it runs by the radius. Carpi radialis. Very good. Very good. Mr. Singletary.
On the test, are the pictures going to be like our flashcards? Because this is kind of hard to figure out what it is. I couldn't see whether the muscle was going all the way down.
They will
like
actually
a
be,
form.
they will be extremely like this, sir. They will be extremely like this. But I've removed, don't worry, so I've removed ambiguous ones. Right? So there are ones I discussed with you that I don't use because they're ambiguous. Because again, I'm not trying to trip you up. I'm trying to figure out, can you do what Mr. Richards just did? That's what I'm trying to figure out. I don't even care if he's right. I care that he knows extensors live on the back of the arm. I care that he knows what the back of the arm is. I care that he knows where the radius is. I care that he knows what the carpals are. And in answering this question the way he did, it doesn't even matter if he's right about the muscle. A doctor would have been impressed even if he was wrong about the muscle, right? It shows he kind of understands anatomy in a much more global sense. And so the test looks for that kind of stuff. And I remove stuff when it's ambiguous. And I've had people get 100 on the test. 100, no help, boom.
Okay.
I've had people take it in an hour and get 100. Don't feel bad if it takes you longer, but yeah. And that's not a Tapscott hour, which is 5 days. That's an actual hour. Yeah, I promise you it's not designed to trip you up at all. It's designed actually to remove anything where you have. It's not designed to see if you're a good test taker. It's designed to see if you understand the concept of where muscles go and how they're named. Miss Carrillo.
What helps me remember that the radius is on the thumb side is I call it like this is, I combine the words and make rum. Radius, thumb, rum.
Oh, radius, thumb, rum.
So rum.
That's going to work for me. Yeah.
So rum.
Yeah. Maybe Miss Demetra, too. She kind of smiled there. She's got the house to herself. Could be a pirate night. Yeah.
Party, Miss Demetrix.
Miss Young.
So my kind of thing is sort of the same. So I'll say like rad thumb, like radius thumb, and like kind of doing like a thumbs up.
Rad thumb and rad. Yeah, I like
Yeah,
Radius
that's
rum.
it. Good. Okay.
Rad rum.
Rad rum thumb. Cool. Rad, dude. All right. Okay. So, Miss Everson, yes?
Sorry, one more input.
Yeah?
I go like Roo Man because this is a Surf's Up thing, and I just go Roo Man. And so this is radius.
I'm learning a lot about each of you and your actual personalities by how you remember muscles. That's
I like
perfect.
drink.
Yes. Miss Carrillo's a lush. Yeah. Miss Everson, kind of a surfer, you know. Yeah. All right. Mr. Singletary, sir. What is this muscle down here? By the way, the pictures on the test are better too. You're seeing them on a slideshow. What, Mr. Singletary, what is this muscle down here in red? Sir? We're getting funny background noise.
I'm sorry. I'm here. I'm
You're just vacuuming?
actually that's the blowers, the leaf blowers outside.
Oh, okay.
And I couldn't.
I really did picture you like, yeah, I'm looking at that. I'm vacuuming the apartment. Yeah. So what do you suppose this muscle is? Mr. Richards really helped us kind of lay out a thought process for this.
Okay.
You want me to walk you through it?
Okay, so it's not okay. So it's not on the radius side. That's the ulnar side. So that's the extensor, carpi, radial, something.
Why'd you throw radial back in there? You said it was on the ulnar side.
Oh wait, what am I saying? Not radial. Sorry. Carpi. Oh, no.
You're about to say it, sir.
Carpi, ulnar. What's the word I'm looking for? Oh, extensor, carpi, radial longus. No.
Brevis.
Oh, stop.
So is it an extensor?
Yes, sir.
It is, and you said that correctly. Is it probably flexing the wrist or the carpals?
Is it?
I mean, it's
stopping where
extensive.
his finger is?
Yeah, it's stopping where his fingers are. You're on the right tracks, or
Okay,
you're just confusing yourself.
That's what I thought. I thought it went all the way.
You know this. Actually, I can tell. You're just jumbling words at the end. So tell me again what this is.
Okay, extensor.
Yes.
Carpi.
Yes.
Brevis.
Stop, don't even worry about brevis.
Oh, please don't worry about that. Okay.
So
Extensor, carpi, ulnar.
yeah, extensor carpi ulnaris.
Carpi ulnaris. Sorry.
Yeah, and I don't care if it's longus or brevis. Hey, look what that is, sir.
Okay.
And you did that without
No,
memorizing.
I just thought it went longer because I'm looking at the red, and I thought it went past where his finger is, and it looked like it was going all the way down.
I think the test will actually be very good for you, sir, because it does not have little stuff like that. It would just have like flexor carpi ulnaris, extensor carpi radialis. It's trying to figure out what you just did, and you did perfect. You're good. Thank you, sir.
Okay. Thank you. Sorry about the leaf blower.
No worries at all. Miss Savarino.
Damn, Mr. Prescott, I knew it again.
Dude, stop. Get out of my head.
I know, I'm like, what the hell?
What do you suppose this muscle is? And I suspect this muscle, by the way, just so you know. By the way, you've got two devices, so I think we're maybe talking back and forth between them. But anyway, I think this muscle breaks up into 4 tendons because I think it's heading out to the fingers. If that helps. They're talking about the middle muscle.
I'm
here.
sorry. I'm sorry. I was disconnecting from my other one. What did you say?
I said to help you on this, I think this muscle branches out to 4 tendons because the 4 tendons are going to the fingers. That's an important thing to know.
The extensor digitorum longus.
Yeah, except just extensor digitorum. There's apparently not a brevis.
Okay.
Again, I would not have longus and brevis on the test. Don't worry, guys. I want to know that you can do exactly what Miss Savarino did right there. She knew it's an extensor. She knew it was going to the digits. It has to be extensor digitorum.
Great, thank you.
Thank you.
Does the 2 devices bother you? Because I have my earbuds. I was just going back and forth so I could watch it.
No. I didn't mind until we were talking and I was hearing my own voice. No, we're good.
Okay, got it.
Yeah, we're good. Thank you for asking. Okay. Mr. Snell. This one there is not a device for. You just kind of either know it or you don't. I can give you a clue though. But Mr. Snell? Yeah.
Yes.
So if you get this muscle, do you need a clue?
Well, what were you gonna say?
I was going to give you a clue.
Can I take a guess?
Yeah!
So does it attaches to the humerus?
It does attach to the humerus. You're absolutely right. It attaches to the humerus and the ulna there. Yep.
Okay, so I think it's the, I don't know if I'm saying it right, but
I think you're about to get it.
is it like Anconeus or?
Good enough for me, sir. Anconeus. That was brilliant. By the way, this one, guys, you have to memorize. There's no way to know it. You just have to know it. The Anconeus extends the elbow just like the triceps brachii. We just hardly ever talk about it because it's a very weak extender, and your triceps brachii is a very strong extender. Very powerful. So that's the Anconeus, and really good job, sir. Really impressive. I honestly, if I didn't teach anatomy and somebody showed me that, I'd been like, I don't know what you're talking about. I'd be like, that's the elbow. Miss Carrillo, what were you going to say?
Miss Everson went before me.
Oh, Miss Everson.
So Miss DeBose and I actually came up with one for this one because we kept forgetting it. So what we did is when we learned this, I remember Sav going, and so I hear Sav going, standing with an ice cream cone, like lifting her arm up a little bit, and then in front of EOS Fitness. So, Conius.
Oh, I love that. Wow. That was fantastic, though. I really like it. Yeah. So if you guys get stuck on the test and you're like, that's a good start right there, that alone. I love it. In front of EOS with an ice cream cone. Yes, Miss Carrillo.
My information isn't as amazing or as interesting, but Ancon, I forget which language, either Latin or Greek, means elbow.
Oh, Ancone in Latin or Greek means elbow. Cool. I like it. Awesome. Thank you, everybody. This stuff helps. You guys will literally remember this conversation when you see this thing again. Okay, Anconeus. Mr. Snell knocks it out of the park. I love it. Miss Suriel. And if you need a hint, let me know. We've actually seen this muscle before, just a different picture of it.
Okay, that muscle, yeah, we saw it like 3 muscles ago. Is it brachioradialis?
Miss Suriel, you're just showing off now. Yeah, it is brachioradialis. She's right. I love it. I love it. I love it. Because it's going from the brachii, it's running down the radius, and yes, it looks like it goes to the thumb, but it just stops here, and that's beautiful. Really well done. Awesome. Thank you. Thank you. Wow. Okay. Mr. Godot, sir, this is a toughie. By the way, guys, if they're super ambiguous, don't worry, I don't test you on them, but it helps us kind of work through the logic here. Mr. Godot, do you have any idea what this muscle is in red here? This is tough, sir. If you need help, let me know.
Yeah, let's talk about it.
Yeah, let's talk about it. Which side of the forearm is this?
The anterior.
Yes. So what type of muscle is this probably? What muscles lie on the anterior side?
Not extend.
It's good. Good.
Flexor.
Flexors. So this is probably a flexor, right? By the way, I probably wouldn't use this in a test because it's very tricky to tell where this guy's going. But let's suppose he just goes across the wrist. Then he would flex the wrist. So we would call it flexor Carpi. Yes.
Carpi. Okay.
And I know it sounds weird, but all flexors start here on the medial epicondyle. This guy comes driving over kind of towards the radial side. And because he's going over towards the radial side, I would guess that it's flexor carpi
radialis.
That'd be my guess, sir. I could be wrong too, by the way.
Okay.
Oh, we're right. Really nice.
Sounds good.
That's a tricky one. That's a really tricky one. Good job, sir. Thank you.
Thank you.
Oh, this is. Oh, that's another. They're showing it to you separate. That's a lot easier to see, really. Flexor carpi radialis. Boom. Nice. Okay. Mr. Overman, I feel like Mr. Godot set you up good for this, sir. What is the muscle here in red?
We did, so that's the Flexor Carpi Ulnaris.
That'd be my guess. It's got to be. Yep, Flexor carpi ulnaris. It's a flexor.
Thanks, Mr. Godot.
Yeah. Boom. Here's another picture of it. Just let you guys soak that in. Okay. So, Miss Young, what is this muscle here? Note that it breaks up into 4 tendons here and goes to the fingers. That's what they're trying to show you. It breaks up into 4 tendons and goes to the fingers.
Flexor digitorum longus?
Yeah.
Or,
so the problem is there isn't, by the way, I love that answer. It's basically right. But
I was going to say, I think that's a toe muscle.
yeah, so, but you've got, no. I mean, well, yes, flexor digitorum longus is your toes muscle. Remember the flexor digitorum, there were 2 of them. There was a superficial one and a deep one. Do you remember that? So one's called superficialis and one's called profundus. Profundus just means deep. This is one of those 2, and I actually don't know which one.
I'm going to guess superficial.
Profundus.
We were wrong.
Yeah, I would have gotten it wrong. I mean, by the way, I wouldn't have the pick between flexor digitorum profundus and flexor digitorum superficialis. The fact that you know it's a flexor digitorum is fine. Absolutely fine. And by the way, I'm not trying to be nice to you guys.
Any of the other answers would trip me up anyways.
Yeah. Yes. No. We're not trying to trip you up, honestly. Okay. So, Miss Mades, if that last one was the flexor digitorum profundus, this one is probably the more superficial one. Miss Mades? Oh, there you are. Good.
Yes, I'm here. It's the flexor
Yes.
digitorum.
Yes.
Digitorium.
Yes. And because it's not the profundus, it's probably the superficialis.
Yes, superficialis.
Beautiful. Thank you, ma'am. Beautiful. This is really good. Mr. Overman, talk to me.
So this might help somebody. The way I remember those 2 is when you're looking at the superficialis, you can see at the origin, it looks like it has 3 clear points of insertion.
And it would
It
actually...
may or may not, but that is how it looks. So that's how I remember that one's the superficialis.
And it looks like it would cover the other one. Yeah.
Yeah.
Yeah, well said. Thank you, sir. Very helpful. Very, very, very helpful. Okay. Oh, let's see. I got some more people to go here. I just thought I was all done. All right. Actually, it's 9:28. 9:28. Let's take a break here. Mr. Singletary, can your question wait till I come back? Or do you want to ask now?
Oh, sorry, I didn't take it down. I answered my own question. When you said the word superficial, I didn't know which one was more deeper than the other.
No worries. Awesome. All right, everybody, let's take a break. We'll be back at 9:44. Miss Everson, give me a call.
Yes.
Miss Hendrickson, this one's tricky. You might need a little bit of help. But what do you think this might be?
I think it's a flexor.
Yes. Good.
Flexor side.
Flexor. It's not going any fingers. It's just going across the wrist.
Flexor Carpi.
Yeah, and here's what I'm guessing. Is it an Ulnaris?
I don't know because it's in between.
Right. It's not an Ulnaris or a radialis. There is another flexor called a Flexor palmaris.
Palmaris.
That's what I'm guessing. This is so vague I wouldn't use it, but I just want to... And it goes to the palmar fascia in your hand. And I'm guessing because it goes right down the middle, palmaris longus. Sorry, not even called flexor.
Was there two palmaris? Oh, okay. Was
Yeah.
there just one palmaris?
I don't remember a palmaris brevis. That's the problem. I don't remember that. Does anybody remember palmaris brevis? I told you I was done teaching you guys. This is it. I've maxed out my stuff. Anyway, good job. It's a flexor. It's a flexor. Oh. Okay. Where was I? Miss Lee, what muscle is this? What two-headed muscle in the brachial region is this? Miss Lee? Dear Miss Lee?
Oh, sorry. I
No, you're okay.
forgot to open my
Yeah.
MacBook. It's a brachii tendon.
Well, it is the brachial tendon, by the way. She's 100% correct. It's the brachial tendon is off the biceps brachii. She gave a more exact answer. That might even be what they're looking for here. Let's find out. Biceps tendon. Also, yeah, but also people also refer to it as the brachial tendon. That was really good. Thank you. That was even better. I love that she identified that it was a tendon and all that stuff. We'll take it. Oh, this is kind of neat. Let's see who. Miss Osuna. What's this little muscle? Oh, hold on.
That is me.
No. That is you. Yeah, no, that wasn't you though. Making the echo. I just had to
Okay.
mute somebody. All right.
That is the pronator.
Yes. Yes, Miss Osuna. These are really obscure muscles, right? Most people know where their pecs are, or their quads, or their glutes, or whatever. But these are much more. If you asked a lot of massage therapists this, they'd be like, I don't even know what you're talking about. That is the pronator teres. Way to knock it out of the park. Thank you. Pronator teres. Miss Pugh, what muscle do you suppose this is? Wrapped all around the radius there.
Pronator, no.
You're kind of in the right area.
Well, you do supination with that?
Mm-hmm. It would actually, yep, pull me over. So what would we call it if it does supination? You're going to get mad when I tell you. What would we call?
I have no idea.
What would we call the only muscle that's this muscle's job? By the way, your biceps brachii is a supinator too, but this is the only muscle. All this muscle does is supinate. So what should we call this muscle?
Supinator?
Oh, what a good idea!
It is like an Alice in Wonderland question.
Yeah, it really was. Thank you, ma'am.
Yep.
That's why we're doing this. Okay. So, this is a little bit hard to see, but, Miss Dimitruck, don't you shake your head at me, young lady.
Still upset about that test.
I know, I can tell. What do you suppose this is?
Is that going down to the pollicis?
It is going down to the thumb, the pollicis, yep.
Yes, pretty stuck. I would say this looks like a extensor.
Yeah. Extensor what?
Pollicis brevis
Yeah, it's probably the extensor pollicis brevis and longus.
and longus.
Because there's two on the back there. That's super nitpicky, and I wouldn't normally get that nitpicky, but let's... Oh.
Come on.
I don't like their answer. By the way, I wouldn't do that too. You're right, by the way. That's the extensor pollicis longus and brevis there. In fact, you said extensor pollicis is just fine. Just fine. Thank you. Thank you. Based, Miss Clayton, on the answer that Miss Dimitrik and I both got wrong, if those were the long muscles of the thumb, what do you suppose these are called?
The short muscles of the thumb?
Yeah. Yeah, a lot of people refer to them that way. The ones up the forearm, they call the long muscles of the thumb. The ones in the hand, the fore in the hand, they call the short muscles of the thumb. Yeah, again, I wouldn't do that to you guys, but thank you. Thank you. Oh, okay. That is the end of all pictures to show you guys. Yes. Yeah? But, quick, name those. Yeah. All right. But, let's, remember that pollicis is Latin for thumb. Pollicis is for big toe. Digitorums go to the fingers and toes. Digi minimi is your little finger or your little toe. Remember that when I say infraspinatus, you say teres minor. Because they're in the same place, they go to the same place, they do the same thing. Remember when I say Latissimus Dorsi, you say teres major because they go to the same place and essentially do the same thing. Remember about the flexors being in the front of the forearm and extensors being in the back of the forearm. Remember that abductors tend to live on the outside of the body to pull things out. That adductors tend to live on the middle of the body or the middle of the hands to pull things back together. Yeah? Just good stuff to know. All right, and we've got time and you have no homework, so we're going to run through these again quickly. Yeah? It's going to be amazing. All right. Miss Green, what is this muscle right here?
Mr. Tasca, I'm really getting excited at the fact that I'm like a psychic because I just know you're gonna call on me when you call on me.
You know what's so weird?
It's really weird. It's getting really weird.
This time it is weird, Miss Green, because I've been using the list on the side of my computer, and you weren't the first person, but I'm like, I'm starting over, and I zip back up the top. So I actually skipped over all these people and just picked you. So you really, yeah, that was.
I feel special and honored, honestly.
It's amazing. I'm freaking out, actually. All right, Miss Green. Well, then you probably know the answer to this too.
Yes. We talked about this. It's an abductor.
Yes.
I know that, and it goes to the pinky. So the pinky toe and the little finger are not holosis, but digitorums. So then we have.
Right? They're little digitorums.
Digitiminimi.
Oh.
So it's an abductor digitiminimi.
Abductor digiminimi, yeah.
Yes?
Yes.
Yes.
Yeah.
Yeah.
I love it. Yeah.
Thank you.
Yep, thank you. I love that. Really good job. Okay. Miss Rader, what are these two muscles?
The flexor digitorum brevis and the abductor pollicis.
Yeah. And as we discussed before, it looks like a flexor, but she's dead on right, everybody. She said that these are the flexor digitorum brevis because she knows there's a longus going up the back of the leg. And this is definitely a holosis muscle, but she's catching now that this tend to go slightly to the outside. And so it's actually an abductor. The flexor, by the way, holosis brevis, lives right here. It's much shorter. It's a little two-bellied muscle. Anyway, Miss Stevens, what muscle is this?
Extensor digitorum brevis.
Yeah, darn right. Thank you, ma'am. Miss Carrillo, what's this?
Flexor digitorum brevis.
Yes, thank you. Miss Everson. Oh, this is so weird. Anyway, Miss Everson, I think you had this question before. What is this stuff on the bottom here?
No. It's fascia.
Yes. In what region? What do we call this region of the body? What do you call the bottom of your feet?
Palmar? No.
That's the bottom of your hand. That's good. Palmar. It starts with a P.
Oh, plantar?
Yes. So this is plantar fascia or plantar aponeurosis. Both are correct. Nice job. Thank you. Mr. Lee, what is this muscle coming down here in front of the leg and going to the toes, going all the digits?
Local familiar.
Yes. That's good. So,
Digitorum.
yes, it is a digitorum. So is it a flexor or an extensor? It's going to pull the toes out like this.
Address extensor digitorum longus.
Mr. Lee, you guessed correctly, which isn't guessing. You did good. Thank you, sir.
Thank you.
Miss Dang, what muscle is this? Miss Dang?
Yeah, yes, can you hear?
Yes, I can hear. What muscle is this?
Thank you. Extensor hallucis longus.
Why is this not clicking? Nicely done, Miss Dang. Extensor hallucis longus. And by the way, just to let you guys know, that would be an excellent test question, right? It's obvious it's going to the big toe. It's obvious it's an extensor. We kind of expect you to put that together. Very good. Thank you, Miss Dang.
Thank you, sir.
Mr. Manzanares, what is this muscle?
Is it the Piriformis longus?
Is it on the side of the leg? Or is it on the front of the leg and does it cross over the foot? Going from the lateral to the medial side. There's only one muscle that does that. It's a muscle on the front of the tibia that crosses over the foot.
Tibialis anterior? Or?
Yes, sir. Tibialis anterior. Tibialis anterior. Beautiful. I like it. Nice. Remember, this connects with the Peroneus longus that's out here to make the stirrup of your foot. I like it. Thank you, thank you, thank you. There's all little flexor things going around the malleolus. Oh, so cute. Okay. Mr. Jones, what muscle is this?
Gastrocnemius.
Mr. Jones, that is correct, but sir, it is correct. Gastrocnemius. How many joints does it cross over?
2.
2. So therefore it can form 2 actions. What are those 2 actions?
Flexion of the knee and a plantar flexion of the ankle.
Right. You plant your foot so hard you stand on your toes. I love that. Really nicely done. Last question. What is the official name for the knee joint? And what is the official name for the ankle joint?
Tibiofemoral for the knee and talocrural for the ankle.
Oh, man! Mr. Jones! He's not just a muscle head, guys. Got brains up there. Yeah. Thank you, sir.
Thank you.
Let's see. Nice, nice. Mr. Ma!
Yes, sir.
What muscle is this, sir?
Soleus.
That is the soleus. Thank you. What actions does it cause?
The soleus?
Yes, what can it do?
Do the plantar flexion of the ankle.
Yes. That's it. That's all it does, everybody. Plantar flexion of the ankle. What's the official name for the ankle?
Oh. Yeah, this is the thing. It's called talofemoral.
Talocrural.
Talocrural.
Yeah, I hate that name, by the way. the talus really is a bone that your tibia sits down on. I wish it was called talotibial, but this is the crural region, so they call it the talocrural joint. I don't know why. Anyway, thank you, sir. Well done. That was good.
Thank you.
Good, good, good. Miss Clayton, what's this muscle? These are the same order that we did yesterday, but I think it's okay. It's kind of cute.
Did you say me?
Yes, ma'am, I did.
Clayton?
Yeah.
The gastrocnemius? Oh, I can't.
I'm sorry, the
Is
one
it
in red.
plantaris?
Yes, the
No, the
plantaris.
plantaris.
By the way, you're right. This big thing back there is gastrocnemius. That's what you're looking at. That's good. Thank you, ma'am. oh, Miss Clayton.
Uh-huh.
What are the action or actions of the plantaris?
It plantar flexes.
Yes, it does. Is that the only action?
Well, I'm guessing by your voice tone, no. It plantar flexes and
Does it cross over the knee?
yes. Oh, it flexes the knee.
Thank you, ma'am.
Mm-hmm.
I like how this is coming together. It's really nice. Mr. Mitruk, what are these muscles?
The fibularis longus and brevis.
Yes, also known as the
Peroneals.
Thank you, ma'am. Miss Hendrickson. What muscles?
Would be that rectus femoris again.
It would be. What two actions can it create?
It flexes the hip and extends the knee.
Very well said. Thank you. Thank you, thank you. Miss Pugh, what muscle is this?
Sartorius.
Thank you, ma'am. What, hey, this is tough. What three actions does the sartorius create? If you kind of grab the inside of your leg, you can make yourself do it.
Like immediately rotate.
Laterally rotate. Yep.
Extend the knee.
It definitely affects the knee, but it kind of grabs on from behind. So it's going to flex the knee.
Oh, flex the knee and extend the hip.
Nope, flex the hip too.
Oh, flex the hip. Okay.
It's tricky because knees are backwards. Yeah, flex the hip, flex the knee, laterally rotate. Thank you, ma'am. Miss Lee, what muscle is this?
Vastus
Yes.
intermediate.
Oh, Miss Lee, yeah! Bam! Vastus intermedius. There we go. Thank you. Miss Osuna, what muscle is this?
That is the vastus lateralis.
Good. What three actions does it have?
It helps with the extension of the knee.
And that's it. It was a trick question. Good job. Extension of the knee, that's all it does. Thank you, thank you. Miss Manes, what is this teardrop-shaped, beautiful muscle here?
It's the medialis. The actus medialis.
Thank you, ma'am. Good job. Miss Young, what muscle group is this?
I think I did this last time too.
I think it's going the exact order as last time. I didn't realize that. I thought you guys were kind of randomly on my screen, but you're in alphabetical order by by your sign-on names. Anyway, what group is it?
Hamstrings.
Hamstrings. Okay. Which hamstrings are on this lateral side?
On the lateral side.
Yeah.
Semitendinosus and bicep. No.
Well, what was the second thing you were going to say?
Bicep femoris.
All right. So these two heads of the biceps femoris, semimembranosus and semitendinosus are on this side. Remember, semimembranosus. Think medial. Membranosus medial. Semimembranosus.
I was trying to say semitendinosus.
Well, that's on this side too, though.
Yeah, but I figured I knew semimembranosus was probably medial.
Yeah, and it goes with the semitendinosus. Those are your two medial heads here. Awesome. Hey, what are the two actions of the hamstrings?
Flex the knee and extend the hip.
Bam! You guys are almost ready to graduate. I like this. Mr. Overman.
Gluteus Maximus.
Yep. Actions?
It does a lateral rotation and an extension of the hip.
Yeah. Where does it insert?
Inserts into the greater trochanter.
Yeah, and also something called the gluteal tuberosity. But also what I want to also kind of highlight for everybody is it inserts in the IT band, too.
Oh, right.
Yeah, you weren't wrong. It's just I want to kind of highlight that. Thank you. So when people have tight IT bands, guys, hit their glutes. Really just rub everybody's glutes, right? Rub everybody's occipital region, rub everybody's glutes, rub everybody's feet, and the whole world will be happy. That's all that matters. Yeah. Mr. Godot! What muscle is this, sir? It'll look familiar.
Gluteus Medius.
Yeah. What kind of action can the gluteus medius create? Since it's on the side of your hip.
Talk to me. I don't know.
Well,
trying to figure it out.
Things on the side of your body can pull things outward. So what do you call it when things move away from the midline?
Abduction?
Abduction, yes. It can abduct. Yeah. And by the way, everybody, you're good, sir. Everybody, just to let you know, if you read real technically, the forward fibers here can actually create a flexion because they're far enough forward. I'm just kind of keeping it simple that this area is essentially for abduction, but you can get really nitpicky with these muscles because these fibers up here are far enough forward to create a flexion. So it's not that I don't know that. It just helps for memorization purposes to keep it kind of simple. All right. Sir. All right. Mr. Snell.
Yes.
What muscle is this?
That is the gluteus minimus.
Yep, beautifully done. Yep. What action can it create? Especially the anterior fibers here.
It's flexion?
Thank you. Flexion of the
hip.
Yeah, what's another name for hip?
Another name for hip.
Yeah. Like where the femur meets the hip socket.
The femoral.
Yeah. Maybe I'm not trying to be inappropriate here, but maybe we should call it the ass socket.
Oh, okay. I got some. The acetabular.
Yep.
Femoral.
Yeah, I like that. It's the tab where you hook your ass. Acetabular femoral joint. I like it. Thank you, sir. And sir, since it can create a flexion of that hip joint, it can also create what kind of tilt with your hips?
Anterior?
Yes, you nailed it. Thank you, sir. Love it. Miss Suriel, what is this muscle? Should look familiar.
I think that muscle around there is the fascia.
Yeah, there's a lot of fascia going down the leg, and sometimes you have to tense it up.
Oh, okay. So the fascia lata has a muscle in the top.
Yes.
Called
the
tendor fascia lata.
Yeah, close enough. Tensor fascia lata. That was great, and it too can create a flexion of the hip. Awesome. Thank you, ma'am.
Thank you.
Miss Savarino, what muscle is this?
Hold on, I had to disconnect myself from my other way.
Yeah, no, I figured.
Let's see. That's an adductor.
Good. I'm already happy.
So I'm gonna just say abductor brevis.
Well, wait, what is that? What kind of? By the way, brevis is correct, but what kind of muscle is it again?
Oh, an adductor.
Oh, an adductor brevis. Yeah.
Yeah. I mess up my words sometimes, you know.
No, you're good. Thank you.
I appreciate it.
Mr. Singletary, what muscle is this, the dark red one?
Sorry, that's the adductor longus.
I love it. Adductor longus. Beautiful. Thank you, sir. Mr. Richards, what muscle is this back here?
Adductor magnus, because it's the front and the back.
Thank you. It's adductor magnus. It's on the inside of the leg still, but it's towards the back. Sir, I haven't discussed this, but I think you can put some stuff together and answer it. What two actions does the adductor magnus have?
So adducts.
Adducts is correct for sure. That's the main one, right? But it's so far back, some people say it acts like a
hip flexor.
A hamstring.
That's it. Yes. Yes.
And so it can also help to do what with the hip, like a hamstring.
So I thought this did medial rotation.
Does the hip adduct? Now I got to think about medial rotation. I mean, oh yeah, I can see that. Sure. But can you also see how it would also cause an extension of the hip too?
Yeah.
Because it's so far
when
back.
it pulls, it would pull you.
Yes. That's. Yeah. I'm just explaining why people say it's also sometimes considered with the hamstrings.
Hamstrings, yeah.
That's a very obscure thing. You won't hear me talk about this again. It's just that you guys know a lot of stuff now, so we're getting kind of nitpicky. I like the medial rotation. I hadn't thought about that. Thank you, sir. Thank you. Where were we? Miss DeBose. Miss DeBose. What muscle is this?
It's an adductor muscle.
Good. It is an adductor muscle.
I lied. It's not.
It is an adductor muscle.
It is?
Oh, God, yeah. It's on the middle of the leg.
I mean, I was thinking it doesn't have the word adductor in it. It's your gracilis, but it doesn't have
yes.
the word. I'm sorry. I was doing something in my head. Anyway.
Got it. Yes, it is an adductor muscle, but not one with the name adductor in it. And you're right, it is the gracilis. Where does the gracilis insert?
Isn't that at your acetat? Wait.
No. That's in your
your knee. Sorry.
It kind of into your medial proximal tibia. But what is the area that we call where it inserts?
Your pes and serratus.
Yes, the goose's foot. What are the other two toes of the goose's foot? Meaning the other two muscles.
The sartorius.
Sartorius is from the front. Gracilis is on the middle. What's coming from the back?
Oh gosh. 1 second. On the back. Oh wait, it's a semi.
It is a semi.
Semi-tendinosus?
Yes, semi-tendinosus makes up the final tendon of the goose's foot. Semi-tendinosus makes up the final tendon of the goose's foot. Thank you very much, ma'am.
Thank you.
Mr. Craven, what muscle is this?
That is the good old pecker.
Hey, you know what? Super inappropriate, but I will never forget it now. I'm actually going to use that in teaching. I love that.
That's what I do.
That's what you do. That is the pectineus.
Yes.
Or the good old pecker, as Mr. Graven likes to say. Thank you, sir, and I'm glad I have that on tape. Awesome. That was actually super helpful. Okay. Moving right along. Oh, I'm clicking the wrong area. There's all the adductors. There's all the adductors. Ha! Okay, Miss Green. What muscle and what structure is this on the side of the leg there?
Is this the outside?
Yeah.
Lateral side?
Yes, ma'am. Lateral side of the leg. Good question. This person's laying.
Would this be considered a deep six?
No, this person is laying. This is their leg, and they are laying on their back. They're looking up at the ceiling.
So this is considered like the top of the leg.
Yeah, this is their knee down here. I don't know if my cursor's there. Hold on, sorry. This is their knee down here. This is their hip here. Their greater trochanter is somewhere around here. This is going off to the glutes.
IT?
Yes. What does IT stand for?
Iliotibial band.
Yeah, it goes from the ilium to the tibia, and it's a band. Iliotibial band, iliotibial tract. If that's true, by the way, what muscle is this? This is a lot of fascia here, you know. Sometimes you got to tense it up.
Is it the tensor fasciata?
Yes. It is the tensor fasciata, guys. The tensor fasciata really does tense up a lot of fascia. It really does tighten up your IT band. That's its purpose. That was good. Thank you, ma'am. Good job.
Thank you.
Miss... Well, we're going to give you a couple, Miss Rader, because I think you already know the answer to this. Miss Rader, what is this muscle? Tensor fasciata. Good. Hey, what action can it create? Flexion of the hip. And if I can create a flexion of the hip, what kind of tilt can it create? Anterior tilt. So it could be responsible for an anterior tilt of the pelvis, which can lead to problems all the way up to the head. What muscle is this, Miss Rader? It is the sartorius. What three actions does it create?
Flex the hip, flex the knee, and laterally rotate.
Flex the hip, flex the knee, laterally rotate the leg. You guys couldn't sit cross-legged without this muscle. You'd never get your leg to come up and turn out and bend in. You're welcome, if you like sitting cross-legged. Yes. And that's why its nickname is the tailor's muscle, because tailors used to sit down like Mr. Richards is right there and sew that way, and so they call it the tailor's muscle. A lot of people don't know it, but Mr. Richards is a tailor. Yeah. So those clothes he's wearing, he made those. Sewed them. Yep. True story. I would never lie to you about the length of a test or Mr. Richards' ability. Cool. Miss Stevens, what muscle is this?
Is that the gluteus maximus?
It sure is. Hey, what bone is this right here?
Yeah. Is it the coccyx or is it the sacrum?
It's the sacrum. The coccyx is probably further down, but you're good. Okay. Hey, what bone is this then down here?
Bone?
Yeah.
The femur?
Yeah. Cool. I'm just throwing in extra stuff, trying to switch up a little bit. Thank you, ma'am. Miss Carrillo, what muscle is this?
Piriformis.
That is the piriformis. What is it known to do when it's being naughty?
What?
What kind of trouble can the piriformis give you?
It can pinch the sciatic nerve.
It can pinch the sciatic nerve. That's when it's being naughty. I don't know where you went with that. What bone is this up here?
The sacrum.
The sacrum, yeah. What structure is this right here on the femur?
That's the greater trochanter of the femur.
Yes, yes. Got it. Cool. Thank you. Yeah, I didn't. Miss Everson, what muscle is this?
That is the quadratus femoris.
Yep, four-sided muscle on the femur. It is one of your deep six, quadratus femoris. Really nicely done. Thank you. Mr. Lee, do you know what nerve this is? It's not a muscle. It's a nerve that runs right through your glutes right here. Mr. Lee? Do you know what nerve this is?
No. Oh, hold on a second.
Wow.
Sciatic nerves.
It is the sciatic nerve. Good job. Thank you, Mr. Lee.
Thank you.
Miss Dang. This is a hard one, Miss Dang. Do you know what muscle this is on the inside of the ilium?
It is Iliacus.
Miss Dan, you are amazing. It is the Iliacus, and yes, that's awesome. Really good. Yep.
Thank you.
Thank you. Jeez. Barely learning this stuff in one language. All right. Okay, Mr. Manzanares, what muscle is this?
It's on the abdominal, or?
It is. It's underneath all the abdominals. It hooks to the inside of your lower back and goes down the same place that the iliacus does, this lesser trochanter here.
Is it the? Oh, I don't think I know this.
Sir, it's majorly important that you know this. Because this is a major muscle.
With the deep six one?
No, those are in back. This is in front. This helps you flex the hip. It's really majorly important you know this. It's not just something you should kind of be so-so about. So.
The psoas major?
Oh, the psoas major! Yes! Awesome. Thank you. Psoas major. I just hit psoas major. Yes. Thank you. Along with the iliacus, we refer to them as the iliopsoas. Good job. There we go. Okay. Abdominal aorta. Okay, where was I? Mr. Jones. Mr. Jones, what muscle is this, sir?
Iliocostalis.
Iliocostalis. Awesome. Mr. Ma. What muscle is this?
Yes, sir.
What muscle is this?
This looks like longissimus.
It is longissimus. Thank you, Mr. Ma. Miss Clayton, what muscle is this? What half of a muscle is this, I should say. But anyway.
Spinalis?
Yep, hooks to the spinous processus spinalis. Nicely done. Mr. Mitruck, what muscles are these?
On the top it's the multidias, and on the bottom the rotators.
Rotators? And multifidi. Yeah. Multifidi and rotatores. Yeah, we'll take
that.
it.
Yeah.
I like rotators instead. Yeah. Yeah. That's good. Thank you. Miss Hendrickson, what muscle is this? Miss Hendrickson, please answer my question. This is the last time I'll be asking you a question, probably. Just about. Miss Hendrickson, going once? Going twice? Or I mark you absent? Yeah? No? Okay. Alright. Miss Pugh, what muscle is this?
Squeeze capitis.
Yeah, Spinatus capitis goes to the mastoid process. What other muscles go to the mastoid process, Miss Pugh?
The longissimus?
The longissimus, yes. Spinatus capitis and longissimus go to the mastoid process. What muscle kind of in front? Well, there's two muscles in front of your body that go to the mastoid process.
Sternocleidomastoid?
SCM, sternocleidomastoid, bow your head down in prayer. Yes, boom. SCM actually can fight with the longissimus and the spinatus capitis. And then there's a two-bellied suprahyoid that goes there too.
Digastric?
Yes, thank you, ma'am. Really nicely done. Really nicely done. Miss Hendrickson, calling out to you again. Oh, there you are.
Sorry, I went to the bathroom.
Oh, all right, that's close enough. All right, Miss Hendrickson, if you answer the following 15 questions, it'll be okay. What is this muscle here?
Multifides?
No, but I know why you said that actually. And people often put it in that category. But it doesn't go all the way down the spine. It only goes down part of the spine.
Oh, is it the splenius capitis?
Well, it doesn't go spine cap. That was what we just looked at here.
Oh.
It just goes part of the spine. So.
Semispinalis.
What?
Semispinalis?
Semispinalis what?
Capitis?
Huh. Yeah. Semispinalis capitis. It forms the speed bumps of your neck. Yes. Okay. Don't go anywhere. You have to redeem yourself. All right. What is this muscle?
That's the splenius capitis.
Yes. It inserts in the mastoid process up here. What other muscles insert into the mastoid process up here?
The longissimus and the sternocleidomastoid.
Yep.
And the
Two-bellied muscle that's a suprahyoid, basically.
digastric.
Nicely done. By the way, everybody, the digastric probably doesn't matter, and you'll probably never talk about it after this class, but it gives you something to show off with at parties or whatever. Okay. Thank you, thank you. Miss Lee, this one's a little tricky. Do you know the name of all the muscles? I don't want to confuse you. This group that's found underneath the occipital region here. It's these muscles underneath the occipital region. Do you know what this is called?
Subcool.
Yeah.
Subcuni.
No. Say it with me. Occipitals.
Oh, occipitals.
Beautiful. Thank you, ma'am.
Suboccipitals.
Yeah, that's a tough one. Yeah. Thank you.
Yeah, thank you.
Thank you. We've all agreed in this class that we'll be rubbing the suboccipitals on everybody, along with the glutes and the feet. That is a requirement. I will come check up on you, make sure it's being done. Okay. Did I pass something there? I hope I didn't. No, I didn't. Miss Osuna, what is this muscle?
That is the trapezius.
Yes, ma'am. What action do the upper fibers perform?
Elevation of the shoulders?
Yes. Yeah, absolutely. The upper fibers produce elevation of the shoulders. And I don't normally ask this, but can they do any other actions, the upper fibers?
Could they technically do the, like a lateral flexion of the neck?
Yeah, they're going to mess with the neck. They could even twist it a little bit and things like that. That's all I wanted you to recognize. Good. All right, middle fibers. What do the middle fibers of the trapezius do?
They retract the scapula.
They retract the scapula. She's actually right. They pull it back. What's another word for that? As my scapula comes closer to my spine. Retract is correct, by the way, but there's another correct answer. What do you call it as my scapula gets closer to my midline because I'm retracting it?
Adductor.
Thank you, ma'am. And what do the lower fibers do?
Help with the flexion of the... No. One second. I know this. I know this.
You're making me feel a certain way right now. I can't tell you how I'm feeling because it would give it away, but I'm feeling this way because you don't know it.
I feel like I'm gonna be mad when I.
Oh, you're gonna feel the way I feel when I tell you what it is. You'll be sad, but for a long time.
Depresses?
Yes, it depresses. Opposite elevator pulls it down. Thank you, ma'am. I'm no longer depressed anymore. Thank you.
Sorry.
Don't be sorry. You guys, we've been packing stuff into your brains. You guys are doing fantastic. Have you noticed that even when you make mistakes now, they're intelligent mistakes? Everybody, I hope you're seeing that. Really good. Okay, Miss Manes, what muscle group is this? And it's not fair because they threw an abdominal in down here, but what muscle group is this? It runs up and down your spine. It's three muscles, actually, but what do we call this muscle group?
Yeah, you got your spayday muscles.
Thank you. I do not like this picture. Excellent answer, though. Thank you. All right. Okay. Better here. Miss Young. What muscle is that?
Sorry, all my alarms went off at once. Is that the quadratus lumborum?
I sure hope so. Yes.
Okay.
It is
I was like, I'm pretty sure that is, but I don't remember.
I mean, I know it's not really four-sided, but it's kind of a four-sided muscle in the lumbar region. It's
I
part
didn't
of,
remember it being so small. I was like, that's in the right spot, though.
that's the crest of the ilium, yeah. What two actions can it create? What action can it create if it works bilaterally? Both sides working together.
Bilaterally. Flexion of the spine.
Oh my god! Does it look like I'm flexing right now?
Okay, I wasn't sure. I was okay.
God.
So it is extension.
Oh, good. Thank you.
I couldn't tell if it was like flexion or extension because it's all weird.
Extension behind. What else?
Okay,
can,
no, I get
what
it
else
now,
can it do?
What else can it do? It can. Oh, what is it called? Is it a lateral tilt?
Yeah, you could argue a lateral tilt of the spine. Absolutely, lateral tilt of the spine. If my spine
Or is
could.
it lateral rotation?
No. Lateral tilt of the spine is correct. If my spine can't tilt, my spine comes to my hips, we call that lateral tilt. What if my hips come to my spine?
It's a hip hike kind of.
Yes, it is a hip hike. It's almost like one side of the hips went up. What would we call that?
Lateral elevation?
Or just elevation?
Okay, elevation.
Yeah. Elevation of the hips. Yeah, of that hip, of that side. Which is why this muscle is nicknamed the hip.
The hip hiker.
Yeah. Yeah, hip hiker. It lifts up your hips, lets you guys walk, lets you shake your money maker, all that good stuff. Okay? Thank you, ma'am. Where? I don't even remember where I was anymore. It's in my mind. I don't. Oh, there we go. Okay. Mr. Overman.
Yes, sir.
Mr. Overman, what muscle is this?
That is your external obliques.
Okay. And this, specifically, it's this guy's left external oblique, right?
Mm-hmm. Yep.
What two actions can it create?
It can create a
Because it goes diagonal.
rotation.
Yep. Rotation to which side?
To the opposite side.
Yes. It'll rotate you to the right. And because it runs diagonally, it can also assist in a...
Can assist in a flexion?
Yeah, if it was working bilaterally, a flexion. Thank you, sir. Nicely answered. Okay. Mr. Godot, what muscle is this? Direction of the fibers is very important. They're basically going back. Doesn't look like it, but they are. Kind of diagonal back. Mr. Godot, sir. Pagey, Mr. Godot? Mr. Godot. No? Lucia? Okay. Mr. Snell, what are these?
Those would be your internals.
Yeah, my internal obliques. If this thing flexes, it can create two actions, believe it or not, because it goes diagonal back here. What two actions can it create?
Rotation.
Rotation is very, very important. To which side?
The same side?
Yes, he's right, everybody. It pulls itself to the same side. Really nicely done. And then if it works bilaterally, what else can it do? We don't talk about this very often, but it's true.
So a flexion?
Yeah, it too helps with the flexion of the hip. Yeah, because it can help pull your hips. Thank you. By the way, that's really because a flexion of your vertebral column is really just a crunch. You know, it's really just a crunch. Cool. Thank you. Nicely done. All right. Mr. Godot? No? Miss Suriel, what muscle is this?
That muscle is the
Yes.
hold on.
Yes.
Oh, rectus abdominis.
Yeah, she said it with vigor. Yeah, Rectus abdominis. Thank you, ma'am. All right, Mr. Godot, you are back. Hold on, sir.
Sorry, I was trying to get to my phone. I have my AirPods in.
No problem, sir. Let's go through all the abdominals together, sir. What muscle is this?
The quadratus laborum.
Good. What muscle is this?
The internal obliques.
Fibers go this way. Put your hands here.
Mm-hmm.
Not putting my hands inside
Oh,
themselves.
external. Sorry.
External obliques. Good. What muscle is this?
Yeah, the internal.
Yes, sir. Internal obliques. What muscle is this?
The rectus abdominis.
Yes. And what muscle is this?
Is that the internal oblique?
Look at where the fibers run. Do they run diagonal or do they run across?
The transverse.
There you go, buddy. Good. Thank you, sir. Okay. Transfer. And that's the 5 abdominals. Boom. Mr. Snell.
Yes.
Mr. Snell, what muscle is this?
The sternocleidomastoid.
Yeah, it goes from the sternum and the clavicle to the mastoid process. Yeah, sir. If it works bilaterally, if both sides contract, what action does it create?
Flexion?
Yeah, flexion of the cervical vertebrae, which is why it's nicknamed the prayers muscle. What if it works unilaterally? Just take your fingers here.
Rotate?
Yes, it does, sir. Exactly. It rotates. In fact, I think it rotates to the opposite side, because when I do it with my fingers, I turn to the opposite side. Good job. Thank you, sir. You don't have to memorize your actions, everybody. Once you just grab your body part and you move, and you got it. Cool. Carotid artery. Miss Surial, I feel like I called on you twice. Am I going around the wrong thing? Anyway, Miss Surial, I'm sorry, but I'm calling on you again. Do you know what muscle this is, or muscles this is?
That one, it's close to the sternocleidomastoid.
Yes.
Oh
Yes.
my God.
It's like if I was a fish, I'd have.
It's one of the scalene.
Yes.
Scalenes.
Yes, it's one of the scalenes. Yeah. So it's just the one that's most up front.
Those I just know the shape
Yeah.
of those 3. One looks like a stairs, and that one, but I don't know. Remember
So
the
what's the
names.
word for in front?
Oh, in front
Start
is hold on.
Take your time.
Anterior scalene.
Yeah, anterior scaling. Thank you, ma'am.
Thank you.
Yeah, good job. Miss Savarino.
Yes, Mr. Topscott.
What muscle is this?
I'm gonna say that's like your. I don't think it's the levator scap, but that's the only thing that's coming in my head.
Well, you should actually. Did you hear what Miss Suriel said?
I did not. I'm sorry.
Okay, well, let's see if I can go back. So she was just telling us about the anterior scalenes found on the side of the neck here. What do you
So
suppose?
I'm assuming that's another scaling, like the posterior one or the middle one.
Yeah.
I'm gonna probably say like the middle because it doesn't look too back of the posterior.
Yes, it's the middle because it goes to the first rib. By the way, the posterior one goes to the last rib. That's good. Thank you. Middle scaling.
Thank you.
Mr. Singletary, what is this, sir?
That's the posterior side of the scalene.
Yeah, posterior scalenes, and they go to the second rib. Yeah.
The second rib.
Good. That's how we know they're posterior. That's awesome. Mr. Richards.
Masseter.
Masseter, yes. Yes.
Masseter.
Masseter?
Masseter.
Masseter.
Thank you.
You're welcome. Whoa, the student has become the master. Okay. Yeah. I think you've been using yours a little too much today, too. To use it to take a bite out of me. Yeah. Hooks from your, shoot, I can't even think about it. Your cheekbone, your zygomatic arch, down to your jaw.
You always get rid of the T's and do D's instead.
Oh.
Masseter.
Masseter. Yeah.
It's masseter.
It is. That's true. That's due. I mean, true. Yes. Mr. Craven.
Yes.
Mr. Craven, I would like to know the name of this muscle.
Yes.
And you're going to tell me. Yeah. What's the name of this muscle?
The temporalis.
Good. Thank you, sir. I feel like you knew that and you just tried to build up tension there. Okay. Miss Green, what is this muscle?
Near our jaw.
Yeah, yep. So it's in what muscle group?
What's it called?
They're above the hyoids. If only I had a word for it.
B.
Oh yeah, that's true. This is Yes. This particular.
Digastric.
Yes. And you essentially have 4 suprahyoids. Digastric is essentially one of them, and 4 infrahyoids. Good. Thank you, ma'am.
Thank you.
You guys massage the suprahyoids. Those of you that rub like around under the jaw and stuff. You're probably hitting all 4. What muscle group is this, Miss Rader?
The infrahyoids or suprahyoids.
Suprahyoids, yeah, suprahyoids. Nicely done, suprahyoids. Miss Stevens, what muscle group is this?
Infrahyoids.
Infrahyoids, yeah. This is the omohyoid right here. Where is it headed to, Miss Stevens? What bone is this omohyoid headed to? It's I think it's the most unusual muscle in the body.
Doesn't it go to like the scapula?
It does. No, it goes to the scapula. It's super weird. Thank you. It goes to the top of the scapula. I still don't understand why. Okay. Miss Carrillo. What muscle is this?
That's the deltoid.
They insert into where on the humerus?
The deltoid tuberosity.
That's right. This bump is called the deltoid tuberosity. What are the origins of the deltoid?
1/3 lateral of the clavicle, and it goes across the acromion.
Yep.
And then I don't know the word for is it on spine of the scapula?
Yes. So, I just asked her origin insertion stuff. I asked Miss Bauer about this when she went to school. You had tests on every single origin insertion. Anyway, lateral 1/3 of the clavicle, acromion process, spine of the scapula. That is the origin for the deltoid. It is also the insertion for which muscle, Miss Carrillo?
Trapezius?
Trapezius. It is the exact insertion for the trapezius. The trapezius just flows seamlessly into the deltoid to help you utilize your shoulder girdle complex. What do the anterior fibers of the deltoid do, Miss Carrillo?
It's because I laughed at you, huh?
Uh-huh.
The anterior does a flexion of the glenohumeral joint.
Yes. Flexion of the glenohumeral joint. What else does it do to the glenohumeral joint?
A horizontal adduction.
Yeah,
of the
it does.
glenohumeral
Horizontal adduction. I love that. And what else does it do?
The medial rotate.
Yeah. And by the way, if I had to demonstrate medial rotation in a picture, I would probably show somebody with a bent elbow and show the elbow with an arrow pointing in. Because otherwise it's very hard to show rotation. What does the posterior fibers do, Ms. Carrillo?
It does extension of the glenohumeral joint
That's true. Pulls it out. Yep.
Glenohumeral joint, and it does lateral rotation.
Lateral rotation. Nicely done. Nicely done.
Well, all I'm saying is that you laughed at Pecker earlier, okay? And that was okay. But I laughed at Skanks.
I thought I said... Anyway. Hey, I want to ask you one other thing. What action am I performing now?
Lateral rotation.
Thank you. Yep. Everybody, it looks weird, but this is lateral rotation, and that's medial rotation. Because if you put my arm down here, that's what would happen. Why is he telling us this out of the blue? I don't know. Okay, moving right along. Miss Everson. What muscle is this?
Part of the trapezius.
Yeah, too easy for you. Miss Everson, what muscle is this in red?
Latissimus Dorsi.
Wow, good. Too easy for you. Miss Everson, what muscle is this?
Teres major.
Yes, because it hooks all the way down to the inferior angle of the scapula. Thank you,
And
Miss
it's
Everson.
a bigger belly than the teres minor.
That's true. Teres minor is going to be smaller and on top. And infraspinatus even kind of on top of that. Thank you, ma'am.
Oh, I don't get any more?
No, that's it. You're cut off. You've had too many. You're getting drunk on anatomy. You know how you get. Okay. What two muscles are these, Mr. Lee?
Teres major and minor.
Mr. Lee, you never cease to impress. Thank you, sir.
Thank you.
Teres major and minor. Yep. Miss Dang, what muscle's this?
Infraspinatus.
Yep, infraspinatus. She's right, everybody. Beautiful. Infraspinatus. Thank you, ma'am.
Thank you, sir.
Mr. Manzanares, what two muscles are these?
It's not the rhomboids, right? No.
No, because rhomboids, think about it, rhomboids hook to the edge of the scapula and hook into the spine. I'm sorry, what, sir?
Oh, nothing.
One of these is a muscle found under the spine of the scapula. Under the spine of the scapula.
Elevator scapula, or?
Well, that lifts the scapula. I want a word that says under the spine of the scapula.
The teres minor?
Teres minor is one of these muscles, but it's not the muscle I was pointing to. But anytime I say teres minor, you say what?
Latissimus Dorsi?
That's teres major, sir.
Oh, it's infraspinatus?
Yes, infra means under, spinatus means spine, so it's infraspinatus. Anytime I say infraspinatus, you say teres minor. Infraspinatus is a small muscle. Teres minor is a small muscle. Latissimus dorsi is a big muscle. Teres major is a bigger muscle, not big, but still, you get the idea. Thank you, sir. Mr. Jones, what muscle is this?
Serratus anterior.
No, but I understand why you guessed that. Believe it or not, this is the serratus anterior down here, these little finger-like projections. This is on the, this is actually on...
Subscapularis?
Yes, it's on the front of the scapula, which you never see. Yeah, it's hard to picture that. This is subscapularis. This is a really good way to attack it. Thank you. Hey, sir. What action does the subscapularis perform?
Ooh. Let me think.
It's on front of my scapula, so it's kind of grabbing me like this, believe it or not, even though we don't see it this way, but it kind of grabs
It would
me.
protract the scapula. Would
Well,
it be protracting?
No, because remember, it goes from the scapula to the humerus, so it's going to do something to the glenohumeral joint. That's it. I wonder what would happen.
Oh, it's adducts the glenohumeral joint.
I mean...
And medially rotates.
Yes, medially rotates. Thank you. That's its rotation, yes. Good. Thank you, sir. Mr. Ma, what's this muscle?
Supraspinatus.
Supraspinatus. What's its action, sir?
It works for the abduction of the glenohumeral joint.
Textbook perfect answer. It was awesome.
Oh, thanks.
Supraspinatus, abducts the glenohumeral joint. Could not have said it better myself. Yes. Love it. Where was I? Now I'm completely lost. Oh, Miss Clayton. What muscle is this?
Can you hear me?
Yes, ma'am.
Okay. That is the teres minor.
Yes. Anytime I say teres minor, you say?
Infraspinatus.
Yes. Anytime I say infraspinatus, you say?
Teres minor.
Thank you, ma'am.
Mm-hmm.
Miss Dimitruk, what muscle group is this? The whole group.
Erectus spinae.
Erect-
I have brain damage.
No, it's okay. I'm worried that Mr. Richard's going to scold you and then me. So it is the erector spinae. You poor thing, we broke you. I should say I broke you.
It's the test.
I know. You can sue for pain and suffering. If they work bilaterally, what do they do?
Extend the back.
Yes, they expand the vertebral column, but I'll take back at this point with where your brain's at. They pull you back. If they work unilaterally, just one side, what do they do?
They give you a tilt.
Yep, a lateral tilt.
Lateral tilt.
Lateral
to
tilt to the
same
same side. Yep, you got it. We're good. You just take it easy, ma'am. Maybe, yeah. You have a little bit of rum tonight. You've earned it. Okay? Remember, radial rum thumb. Yeah. Okay. Miss Hendrickson. Just about done, guys. This is your last kind of time. All our lectures after this will be about how to apply for massage licenses and stuff. Miss Hendrickson, what muscle is this? This worries me.
Rhomboids major.
Yep, and minor, by the way.
Is that right?
Yeah, rhomboids major and minor. What action do the rhomboids create?
They retract the scapula.
And what's another? You are 100% correct. What's another word for retract?
Adduct.
Thank you. Miss Pugh.
Yep.
What muscle is this?
The trapezius.
Yes, that's too easy though. Hold on. What muscle is this?
Is it the levator scapula?
Yep, all day long. What's its action?
Elevate the scapula?
Yes, totally true. By the way, guys, I'm not mentioning every last thing. This also helps to downwardly rotate the scapula, believe it or not. Because if you pull on something on this side, it can kind of downwardly rotate it. But still, point is, it elevates the scapula. Thank you, ma'am. So weird to hear your own voice. It's not pleasant, actually. All right. We're skipping that. Aha. Miss Osuna, what muscle is this?
That is the serratus anterior.
Yes. What muscle helps the serratus anterior because it also protracts abducts and depresses the scapulothoracic joint? What muscle works in synergy with this muscle? What muscle is its buddy? They're kind of in what?
Sorry, go ahead. You can finish your sentence.
They're kind of in a gang together.
The pec minor.
Yes, throwing gang signs. That's right, pec minor. It was a really stretch on that one. I'm sorry. Okay, and the serratus anterior and the pec minor gang like to fight what gang? I've got to stick with the theme, man. Who do they argue?
With the rhomboids.
Yeah, rhomboids major and minor. Yep, thank you. Nicely said. Beautifully done. Miss Mares, what muscle is this?
The pec major.
Yep, pectoralis major. Thank you. Miss Young. this is the pectoralis major because Miss Mars just told us, and it says it on top of this slide. What actions? What actions do the pectoralis major create? And of what joint? Which I even care about more than the actions. Which joint does this muscle affect?
Medially rotate the glenohumeral joint?
Thank you so much. Just the fact she said glenohumeral lets me know that she knows it goes across to the arm and affects that. And it does. It heavily medially rotates the glenohumeral joint. It will do other things, by the way, because all the way its fibers run. It will also do a flexion. It can actually even help with an extension sometimes, and definitely help with a horizontal adduction, which is why we use it in bench press. Thank you, thank you, thank you. I have one more question for you, though, Ms. Young, since you're on fire right now. And since this, we know this is the pectoralis minor because I left the slide up there with the answer. But what action does this create, or two actions does this muscle create, and of what joint?
I'm going to say elevation of the glenohumeral joint.
It doesn't go across the glenohumeral joint. It's hooked up here to the coracoid process of the scapula. So it moves the scapulothoracic joint. It doesn't move your arm at all. And it looks like
is it still elevation though?
Well, I don't know how you could be underneath something and pull it up. I kind of feel like it's down here.
So like retract or depress?
It will definitely depress and protract the scapulothoracic joint.
Oh.
All right, ma'am. Thank you. Thank you. Thank you. I don't even know. Oh. Mr. Godot, what muscle is this?
It's like the bicep.
It is the biceps, sir. Good job. How many joints do the biceps cross over? Or what? It is a good question. It's like in school when you're like, that's a good question in the essay. Fill up some space.
Another glenohumeral joint is up there, right?
Yep. Does it cross over that joint? Yeah.
Okay.
And the elbow joint. Good. Thank you, sir. I just want to make a point to everybody. We think about this thing as flexing the humeral ulnar joint, and it does. That's its main job. But don't forget it crosses over the shoulder, and it can actually help in a flexion of the glenohumeral joint, which means it can be involved in shoulder problems. That's why I'm emphasizing that. Cool. Thank you, everybody.
The answer two joints?
What? The answer is two joints. Sorry. You're right. I went off on a tangent there. Okay. Thank you. All right. We are 2 minutes away from ending here. All of this will be on tape. All of this is under the lectures if you wanted to watch it again. Mr. Richards, you have a question or maybe even a comment.
Do you know in the test, will it say more AB duct or AD duct rather than protract and retract?
Oh, I don't remember.
Which, because I know more of the AB duct and AD duct rather than the protract and retract. Right. Do you know though?
So I don't mean this the way it's going to sound, but you better learn which is which then.
Okay.
Because here's like I would normally answer your question, but I don't know, and I don't want to go back and look because I want you to know that protracting is abducting and retracting is adducting of the
I just get
scapula.
them confused sometimes.
I know.
The same as synergist and an antagonist, I get them a bit confused sometimes.
Well, like just Miss Dang and I are synergists, and
you're antagonists.
We antagonize each other, right?
Yeah, so I'll have to research that a bit more. Thank you, sir.
Thank you. I'm sorry I'm not being more helpful, but I want you to know that. I want you to figure that out respectfully. Yeah, and you can. I mean, Mr. Singletary.
I can help him out with the antagonist part.
Yeah.
You and I are antagonists, Mr. Richards. You get it?
Yeah.
Oh, yeah.
Exactly.